again. It's nice to have you here. Glad you could make it. And we're going to show you a little bit about Dayspring Village. So let's go ahead and we'll go ahead and get started in here. Let me scoot around behind you and grab the door. We'll pull that closed. Try to keep that closed as much as we can. Okay, this is our client management office. This is, of course, my office in here. This is where I do most of my work, in case you ever want to come see me. But this is our client management office. This is really where the important work of the facility happens. So here we have a team of client management specialists. Their primary job is to collect and identify client information. And that's information that might indicate a change in your condition, changes in symptoms, a request to see a case manager, a request to see a doctor, or simply following up on medications and other kinds of medical needs. So one of the things that happens here is our client management team will essentially provide documentation to 4 mental health case managers that are assigned exclusively to Dayspring Village. We have a primary care provider who comes here each week. We have a psychiatrist who comes here at least once a month. We also have 2 licensed mental health counselors who come here to provide on-site mental health therapy. There's also an on-site group, psychosocial group, that is conducted here in addition to other programs and services. So we'd like to kind of show you a little bit about why this is all important. Most of our client management team utilize the computers and utilize all the systems that we have here to convey this information electronically to the case managers, to myself, and to the other people that are important or play a role in your care. So one of the things that we try to do is make sure that we get accurate information in a timely way to those clinical providers, so changes in your medication or changes in your plan of care can be made in the appropriate way. One of the things that we do that a lot of places don't do is we will check your oxygen saturation, and this is a little device that will help you check your oxygen saturation level, and will actually measure where your O2 level is. And why is that important? For people with schizophrenia, oftentimes they smoke. They smoke on a regular basis, and of course people who live at Dayspring Village are no different. And so it's important that your oxygen saturation remain above 90%. And so one of the things that the staff here at Dayspring Village will do will track that, among other things, such as your blood sugar, your blood pressure. They'll also check to make sure that you don't have any other kinds of physical issues that need to be addressed. And that's one of the things that will happen here. We have 2 resident care coordinators. We have a client management team, and our resident care coordinator works with the case management team and all the ancillary service providers that really make our system of care really work well. So let's get on and go have a look at where the real work happens, and that's back here in the back of our facility. This is the personal care room, and this is where we will conduct haircuts and shaves and grooming, and we will make sure that people receive personal care services from 2 p.m. to 4:30 p.m. There is this facility here